There are some women who are trying to get pregnant but can't, and the problem could be their thyroid. What's going on, everybody, and welcome to the Easy Thyroid YouTube channel. So as you can tell by the title, you already know what we are going to be talking about. So without any further ado, let's get into today's video. So the first question is, can you get pregnant with a thyroid condition? Absolutely, 100. And yes, the thyroid does play an important role in reproductive health and the development of the baby. Now remember, I did tell you that in previous videos that the thyroid gland is a small butterfly-shaped organ that is located in the neck. Now, your best chance at conceiving or having a healthy pregnancy is when your condition is properly managed and treated. Now, having said that, knowing that you have a thyroid disease gives you an advantage over people that don't know that they have a thyroid issue. Now, fortunately, there are some women who are trying to get pregnant but can't, and the problem could be their thyroid. Now, I'm not saying that that is the issue, and of course, there are other factors that play in the role of a woman's ability to conceive, but this is just one factor that should be considered. Now, before trying to get pregnant, there are certain things that you should know and do. And number one is talk to your doctor about your plans on becoming pregnant. Now, we know that thyroid hormones are vital for overall health, but we also know that thyroid issues can affect pregnancy if they aren't handled first. Thyroid diseases are often diagnosed by your general care physician or endocrinologist, and that is a doctor who specializes in hormone abnormalities such as thyroid disease. If you are already seeing one of these specialists, then tell them you are trying to start a family so that they can help you control your thyroid illness before you get pregnant and avoid reproductive problems later. Another thing you should not do is stop taking your medication without talking to your doctor. Now, there are some people who worry about the side effects of the medication on the baby, but in this case, the benefits outweighs the risk. And I'll tell you why. You have to remember that your thyroid is not functioning as it should. So the medication you take is actually hormonal pills to provide the body with the needed hormones. These hormones do play a role in the development of the baby. Now, I want us to look at the effects of hypothyroidism on pregnancy if left untreated. So there's an increased risk of anemia, there's an increased risk of preeclampsia, there's an increased risk of low birth weight, increased risk of miscarriage, there's an increased risk of stillbirth, and also there will be problems with fetal growth and brain development. Now guys, before we go any further, if you find this video informative, then please subscribe to the channel. If you want free recipes for hypothyroidism, then click the link in the description. So now we're going to look at the effects of hyperthyroidism on pregnancy if left untreated. There's an increased risk of premature birth. There's an increased risk of thyroid storm, and that is a sudden worsening of symptoms. There's also an increased risk of preeclampsia. And there's an increased risk of fast heart rate in the newborn, increased risk of low birth weight, and an increased risk of miscarriage. I want you to keep an eye on your TSH, and the TSH just stands for your thyroid stimulating hormone levels. Now, the thyroid stimulating hormone, or TSH, is a hormone produced by the pituitary gland, and that informs the thyroid gland on how much T4 and T3 to produce. So a high level of TSH usually indicates hypothyroidism, and that is when your gland is underactive and not responding to the signal from the pituitary gland to make the thyroid hormones. So the TSH is extra high while the thyroid hormones are low. And a low TSH usually indicates hyperthyroidism, and that is when your thyroid gland is overactive and extra thyroid hormones is inhibiting production of the thyroid stimulating hormone. So in this case, the TSH is low while the thyroid levels are typically high. So I was doing some research, and according to the Endocrine Society, it says that all women considering pregnancy with known thyroid dysfunction should be tested for abnormal TSH concentration before pregnancy, and that the TSH should be below like 2.5 MIU, and that is per liter, right, during the first trimester. So normal TSH values can range depending on the labs used, but they are typically between 0.4 to 4.5 MIU per liter. So you should ask your doctor a lot of questions, and during this time you should learn about the changes in your thyroid during pregnancy. Now, the thyroid hormones fluctuate naturally throughout pregnancy, right? So that is something that you should expect. You also have to monitor your iodine nutrition before and during pregnancy, because iodine is a key nutrient for thyroid hormones and thyroid health. The lack of iodine can lead to hypothyroidism, and if you are planning on becoming pregnant, then you should ensure that you are getting enough thyroid hormone in your diet, and your doctor will advise you accordingly. And some doctors may advise you not to take supplemental iodine if you are taking levothyroxine, and that is just a hormonal pill that persons take. However, since prenatal vitamins are an essential part of preconception and pregnancy nutrition, it is important to talk to your healthcare provider about whether or not a prenatal vitamin with iodine is right for you. Okay guys, we have come to the end of another video. Thank you so much for watching till the end. Don't forget to like, comment, and subscribe. And if you want free recipes for hypothyroidism, then click the link in the description below. Until next time, bye.